The rules governing Ballad Health are getting their biggest set of changes since the system's creation in 2018. Tennessee's Department of Health rolled out a revised terms of certification for Ballad today. Rival systems merged to create Ballad. The federal government would normally challenge that inpatient monopoly. To avoid that, though, state rules and oversight aim to prove the new system's advantages outweigh disadvantages caused by decreased competition. The state says the new changes focus on quality of care, the system's overall scoring, rural hospitals, charity care, and public listening sessions. Jeff Keeling has been digging into the proposal during the back and forth. Jeff, what can you tell us tonight?
Yeah, Casey, we obtained documents during those negotiations and reviewed what the state was proposing. We covered the main topics with Ballad CEO Alan Levine earlier this year as the department and Ballad were ironing out those final details.
Everybody knew there was things that were going to work well, things that needed to be tweaked along the way.
That was Ballad Health CEO Alan Levine earlier this year when the system was negotiating with the Tennessee Department of Health. Those talks have now produced the biggest tweaks yet to the rules of the game for the hospital system.
Fundamentally, we are all in agreement. We want to see access and quality of care be the guidepost for what we're doing here.
Because it has an inpatient care monopoly, Ballad operates under terms of certification. 50 pages of rules and another 70 of exhibits, all designed to make sure the system provides public advantage that outweighs drawbacks from decreased competition. The state said today 5 main areas are seeing changes. 1, quality improvement measures will now comprise 40% of Ballad's annual score, up from 20%.
We're in full agreement that a greater portion of the COPA needs to be measured based on quality. We think that there's very real and important improvements in quality that ought to be reviewed and that I think the vast majority of people would agree are relevant.
Rural hospitals must be maintained as hospitals for 4 extra years to 2028, or 2 years if a critical federal funding measure to increase Tenn care reimbursement isn't approved.
If you go to any rural community that's lost their hospital, it isn't just, first of all, mortality rates go up in that community. The economy in that community suffers. Those are good paying jobs for that community. Access to physicians deteriorates dramatically because the hospital does support those physicians. So I think people in the rural communities are very concerned about the loss of their hospitals.
The terms now require Ballad to maintain its financial assistance policy for lower income patients and support project access for people without insurance. Levine said the changes mostly revolve around access, quality, and cost, the 3 factors the state says contribute most to that public advantage.
That's what I'm concerned about is everybody that comes into one of our hospitals or one of our care sites, they're getting competent care from people who are highly qualified to deliver that care. It's being done in a way that's respectful and that we want the outcome to be good every time.
So bottom line, Casey, Ballad accepted terms that put it on the hook for more stringent quality scoring. They keep the area's rural hospitals open longer. Access for lower income and uninsured people is solidified, and the public could have more input. Now, Ralph Alvarado, the health commissioner, said the state takes its role in the country's largest COPA seriously and wants to remain transparent in its oversight.
Jeff Keeling.